Well, welcome everyone to our second annual Dermatopathology Fellowship Forum. This is being held through the ASDP, and we're really excited to bring you a group of very experienced dermatopathologists at all levels. We have our experienced fellows, our young faculty, and then our experienced dermatopathologists and fellowship directors who will be answering some of the most common questions that we encounter about dermatopathology fellowships, the application process, and what to expect during the fellowship. So in terms of who you're going to be seeing and hearing from today, these are your course co-directors. I'm Alex Flam. We also have Catherine Chung and Rachel Kowal, who will be helping to moderate and answer questions as well. We have Greg Hostler and Melissa Pilling, who will be joining us, talking to us from the dermatopathologist and fellowship director experience. And then we're going to be having Matt Helm and Brandon Umphris, who will be speaking to the experience as a young dermatopathologist who more recently experienced fellowship. And then we have two great current fellows, Jen Scott and Daria Ajayi, who will be talking about the fellow perspective as well. Before we get started, I really just want to thank everyone, both the participants who are coming on today, but also our moderators and our panelists for taking the time on this evening to speak to everyone. So with that, let's get to the fun stuff. I'm going to stop sharing my screen, and we divided these questions into several sections. So we are going to start out with our questions about the ACGME program requirements. One other thing before we get started, if you have any questions that we're not answering, please put them in the Q&A. Chat would only be if you're having any technical issues. We will look through these, answer them as we go through, but also if there's any that we haven't gone through by the end of our Q&A session, we'll go through those one by one. So with that, I'm going to pass it over to Catherine, who will start us off with our first set of questions.
Awesome. So excited to be here. So thanks so much, everyone, for joining us. We're going to do kind of an overview of dermatopathology fellowship in general and kind of what it means to do that fellowship program through the eyes of the ACGME and the accreditation and requirements that are required. I'm going to have Greg kind of start us off. If you could give us a general overview of how long a fellowship is and, and generally what people can expect for their training.
Thanks, Catherine. Yeah, sure. And chime in if I say something incorrect, Melissa. But, most of these programs are 1 year. I know there's a few out there that are 2 year, but that second year is often research related. There's 1 core year of learning dermatopathology, and the requirements of the ACGME, of course, there have been in evolution. There's been some relaxing of some of those requirements recently, but in general, it stays the same. Basically, as you know, you can enter the fellowship coming from dermatology or pathology, and depending on which residency you come from, it will dictate your rotations. For the pathologists, you have to spend some time in clinic, and basically it comes down to 4 full months. What most people do is 8 half months of clinic training, and the rest would be in dermatopathology. That's for pathology trained fellows. Now, for dermatology trained fellows, it's the same amount of dermatopathology, but instead of going to clinic, which you've done for the last few years, you do rotate through various subspecialties, particularly surge path, cytopath, and heme path. And oftentimes programs will intermingle, a little bit of management, a little bit of molecular, direct immunofluorescence, and those types of things. But your core rotations are your surge path, your heme path, and your cytopath. I mentioned there have been some relaxing of the guidelines. The program directors recently pushed back on some of the stringency associated with meeting certain case numbers in cytopathology and some of the other rotations. But I think the spirit of the fellowship stays the same. Most program directors expect if you're coming from dermatology, that you do spend a significant amount of time learning about hematopathology and search path and cytopathology, because those are types of things those are some of the tools you need when you're analyzing a slide. And vice versa for the pathology trained fellows. There's some relaxation of the number of patients that are required and how you can count those patients. But again, the same holds true. The spirit of is that, you will only become a better dermatopathologist the more patients you see, more rooms you enter, the more you listen to how patients are managed and treated, and get a full experience from there. So there are no specific requirements regarding your clinic time. Do you need to see MF? Do you need to see immunobolus? It's really up to the program director to make sure you get a nice mix and cover the entire thing. So I'll stop there, but if you have anything more to add, Melissa or Catherine, you have anything else, I'm happy to answer.
That's perfect. Melissa, could you maybe comment on things outside of those, obvious requirements by the ACGME, like opportunities for research and teaching, and kind of what your program offers and what fellows can expect with that regard?
Sorry, muted. You think I'd know this after, 3 years of this. And so some of those soft things vary from program to program, and that might be something as you're looking at programs that you want to think about. Our program, our fellows do a lot of teaching. They spend the mornings generally with a derm resident or a path resident or both. And then they teach them at the microscope, or they divide up the cases, and the students are looking, and they'll bring over to the fellow, and the fellow can teach them. And then we have a conference for our derm and path residents that happens once a week, and our fellows teach that conference with supervision by the attendings, and they teach unknowns. And I went through our fellowship many years ago, and for me, that's really how I learned derm path. I learned a lot by teaching it to the residents and hearing their questions, because their questions made me refine my knowledge and made me think about the things that I was saying and what I was doing. And it really, I think, made me a much better dermatopathologist to teach. And so those opportunities are going to depend on how many residents are around, how closely affiliated your derm path fellowship is with the residency program in derm and path. And so if having a lot of teaching experience is really important for you, then look for that when you're looking at programs. And in terms of research, we have a requirement that our fellows present at the ASDP, and that they do a research project over the course of the year, and they have to do a QI project. And I think some programs may have more or less requirements than we have. But again, if research is important to you, then you will seek out that type of a program that offers and encourages more research. And again, I think that gives you a chance to develop expertise in something, doing a research project. You learn a lot about the entity that you're studying by doing those things. So I think it's a really important part of your training.
Yeah, precisely.
Yeah, and other things, our path trained residents go to our conferences for our dermatology residents, and especially the ones for the first year that are tailored to the first year residents, because that's the kind of thing they need to learn. Our derm trained residents will go to path conferences like the lab management part of the first year path training. And so if you can get some cross learning with those other programs, I think it's really helpful.
Perfect. So Greg had talked about how the experience depending on your training background will differ during your year. So I think this is kind of an area that is can be really new or daunting to people, especially coming from a path background and having something to do clinic, and then vice versa, someone from a dermatology background now having to do a lot of pathology that's even outside derm path. So Daria, if you'd be willing, tell us about kind of the clinic experience for you and what that looks like.
Hi. So with the clinic, for me, it's more getting to see a lot of cases and then see how it's managed, getting to see kind of how the correlation between path, because the way my half in, half month is designed is that I go to clinic the day before, and then the next day I'm looking at the slides. So that way I can have like a good correlation between the clinical presentation and the pathologic findings. So I thought that was a good thing for in my program where, you know, I could actually do this correlation instead of trying to track down like cases from like months back when I can't even really remember. And then the interaction also with the residents. And in certain settings, I'm given opportunity to, you know, interact more with the patient and kind of just have a feel of why certain decisions are made, and why I'm getting certain specimen and why it's a punch versus a shave. You know, just kind of the kind of questions that you would answering the kind of questions that you might struggle with either in a, you know, being in clinic and trying to walk through the process of why the clinician might have, you know, done certain procedures or certain things in certain way, and why certain differential diagnoses clinically are more related than pathologically, or like in microscopy. So for example, say like a, you know, like a BLK can look like a BCC. Sometimes you know, don't know that if you had not gone to clinic and, you know, some other things. So yeah, that's kind of my experience in clinic. It's just, you know, more like correlation and depending on the attending, I've had different levels of hands-on experience, also, which I think is a good thing because you might not understand the challenges of getting certain specimen. You know, you might be thinking, why is this so small? You know, if you know that it's the gingiva they're getting it from or somewhere around the eyelid, you know, then you know, you've gone through that struggle a little bit of, or at least I've seen it up close. So all these things I think is just well encompassing to make my experience more wholesome in clinic, I guess.
Yeah, thanks so much for sharing that. I know every program will have, you know, their own structure on how they will fulfill the requirement of, you know, the 4 months in clinic or 50% of the latter 8 months of the year. At Ohio State, where I am, we send our fellow there for the latter 8 months of the fellowship year. They spend the morning in Dermatopath and the afternoons in clinic. But I like that your program does that, you know, alternating. So it's kind of giving me ideas too about how to incorporate something new. So Jennifer, you coming from a dermatology background, could you kind of share with us your experience, you know, doing fellowship and with kind of more supplementing with the pathology aspect?
Yeah. So I think when I started, I kind of thought, oh, like, you know, thinking of the important things like seeing bone and soft tissue, things that have overlap with derm path, obviously heme path, because we see a lot of those cases and that is really helpful. But or then like being able to like identify different tissues in the skin, let's say like metastasis, that's kind of what I thought it was about. But then I realized I was learning a lot more than that from the different pathologists. I think just seeing the way they approach each specimen and how they handle things. You know, from each service, everybody handles things a bit differently. And I'm trying to think of like good examples, but of course I can't think of them off the top of my head, but just their approach to the slides, how their workflow works and stuff. All those little things kind of like add up and just are very helpful. Having come from a background where I spent many years like not ever being anywhere near a lab. And not really kind of knowing how it works other than just getting the slide. So I think that was the thing that actually is like very helpful. And I wasn't really anticipating that until I went and rotated.
Yeah, great. Thanks so much for sharing. I see a question in the Q&A about kind of the number of programs and the deadlines and application process. So I'm actually going to hand it back to Alex to kind of go over all of that in kind of this next section.
Yeah, absolutely. That was actually a perfect segue now that I'm seeing that over there. So this one I'll probably start geared more towards Greg and Melissa. So talk to us about what the timeline looks like for the DermPath Fellowship application process, you know, when it opens, when candidates usually get interviews, and when decisions are usually made.
Melissa, you want to start this time?
Sure, sure. So applications usually are open over the summer, any day now, people should be opening their applications. So you have the summer to put in your applications, and then most people interview towards the August, September kind of time frame, maybe even late July, get their interviews in so that match lists can be ready to go in for the match in early October. I don't know the date this year. Maybe somebody else knows the date this year.
Yeah, but that does bring up the point that we have as a group been trying to head towards a match, and we've made some baby steps towards that. I think right now we're in agreement that many of the programs are agreeing on a timeline. It's not an official match, and the ones that agree on that timeline, those dates will be posted on the ASDP website if they haven't already. But that time frame that Melissa mentioned is accurate. I mean, basically, you're submitting applications now. We've started receiving applications now already. You'll send them through the summer. Most places won't start interviewing until late summer, and then the offers will come in whatever that designated date is. But it's usually in the fall, kind of around the ASDP meeting. It's in that time frame, and then there's a little time crunch where people have to make a decision, and you have a day or two to make a decision, then you move on to the next one. But a lot of groups, a lot of programs still do not participate in that, oftentimes when they take someone in-house, or they're just not interested for whatever reason. So you really have to look into each group individually. ASDP is a great resource to find the programs that are participating. And if you don't see it on that list, then you need to contact the programs directly and just see where they stand.
And then maybe by a show of hands for the panelists, how many of your programs are part of the Universal Timeline? You can raise your hand, yeah. So yeah, it seems like a large majority are, and I know that we had been speaking with Krista Marco, who is the head of the Fellowship Directors Committee for the ASDP, and it sounded like of those fellowship directors who've recently answered a survey about their interest in the Universal Timeline, the majority are involved. So it does seem like there's a push towards that way. For everyone else on the group, does that sound like a very similar timeline for you all? Were there any variations or differences from that? I'm not seeing anything, so I'm going to assume we're all on the same page.
Alex, can I say something? I think it feels really early, especially for our derm applicants who have maybe only spent 1 year in dermatology and have to really decide what they want to do very early. I know my residents struggle with this. And so part of this whole thing about a timeline is to try to be able to eventually move it back. So it's, maybe 18 months or a year ahead, so that it gives people a little more time to decide what they want to do in experienced derm path.
Yeah, it probably doesn't help the people on the call this time, but that is the goal. In fact, I would even argue we need to get closer to the residency match, which is, 3 to 6 months prior to start date, just because, life happens. If you commit to something 2 years ahead of time, you don't know what your personal situation is going to be like, or your geographic restrictions. So this arms race that we've had to make things earlier and earlier and earlier has done us, I think, a disservice. So I'd like to get back to that reasonable time frame.
And does it matter when in the application cycle an applicant applies? So for instance, if they put in their application now as opposed to July, does that make a difference?
Well, for me, no. And in fact, it might hurt your application potentially if you've made some significant strides or a publication or something in that meantime. I mean, I'm not looking at those until we're, a couple weeks out of interviews. So they're just accumulating. We have a coordinator who's collating them, making sure they have all the pieces, and contacting the applicants. But it's no advantage at our program. I can't speak for others though.
Same for us. We don't look at it till we have them, and So you want to meet your program's deadline, but we don't track who gets theirs in first. I think, some application things, I think you want to be really courteous and kind to the secretary or the admin assistant who you're dealing with and getting your application in. Because, we do hear about applicants who may be struggling and that, so you don't want to be that person. You want to get your stuff in on time. You want to make it easy, and you want to be very pleasant and kind to the person on the other end who you're dealing with, and don't make them chase you for stuff too. Get your stuff in like you're supposed to. If you have questions, call them, ask them all the questions you need, but be very kind and pleasant to them.
I would echo that, and I would say, it's almost like something shouldn't have to be told, but I think you guys are benefiting by coming to this session here. And to Melissa's point, we take very seriously comments made by our program coordinator, from our current fellows, from their interactions, because that's potentially when fellows have their guards down, and you find out what their true colors are like. Now, anyone can fake it for an interview, but I think you should always be on your best behavior and courteous, but you should be that way in real life, not just for the sake of getting a spot. So just keep in mind that, people are watching. People are watching when you're not applying to fellowships. People are watching when you're, out at the grocery store, so, it's just a good life lesson, living your life that way.
Mm-hmm.
Absolutely. All right, now for Matt and Brandon, I have two questions for you to talk about. So one is, what should applicants be looking for when they're applying to a program, knowing that you have the perspective now of fellowship and a couple of years out in practice? And do you think away rotations are necessary for, being a competitive applicant?
I can take that second question. So I think away rotations, they're great. I would encourage them, but I don't think they're necessary to being a competitive applicant. I think there are exceptions, like, obviously if there's like one program or a couple programs where you're highly interested in going there, I think doing an away would be beneficial. But I think overall it's not necessary. Going back to what Greg was saying, I think, making really good connections at your home institution, developing good relationships with program coordinators and people you work with, fellows. I think doing all those things at your home institution can be very beneficial without necessarily doing an away rotation. But all that being said, certain things can stand out on an application as well. So, having a rock star away rotation wouldn't necessarily hurt as well. So I'm not sure how you feel about that, Matt.
Yeah, I echo what you said, Brandon. I'm speaking towards my experience. I did a derm residency, and we have, a derm path fellowship at Penn State. So I already got to know the, dermatopathology team. I think it could benefit you more if you don't have, a derm path fellowship locally or at your institution to do an away rotation. Going back to what we were kind of talking about earlier, I had a gap year as an attending because I decided to apply to my fellowship late. And that's also not uncommon. So, I did dermatology, so I would have had to apply at the end of my PGY2 year, which was like just after 1 year of dermatology. I didn't know I liked derm path at that point. So I ended up applying at the end of my PGY3 year. I was an attending for a year, and then I went back to do my fellowship, and that's also a possibility. So, if you decide late, it's okay.
Yeah. So in kind of a similar vein again, I actually did an away rotation at the NIH kind of early during my residency. I wasn't interested in derm to begin with. I actually was thinking heme path. So I rotated at the NIH, got to work with Elaine Jaffe for about 6 weeks. And what I really took away from that was really like improving my diagnostic skills. So I think ultimately these away rotations, I think we shouldn't lose sight of what is most important here. And I think that's building diagnostic skills and kind of honing who we are as pathologists. Yeah, and then aside from that, it was good for starting conversations with people and just something to talk about, like, oh, well, they did things this way at the NIH. But so yeah.
These are really helpful perspectives. Now, I'm going to ask one more question before I transition over to Rachel. And since we're going to be talking next about interviews, there's been a couple of questions in the Q&A about whether interviews are going to be held virtual or in person this year. So I'd like to get the perspectives, maybe start with Melissa and Greg to get your input, and then we'll see what the rest of the other panel is doing.
Greg, do you want to go first this time?
Sure, yeah. So I'll give you just a little perspective. Back before COVID, we used to do all of our interviews at the ASDP. I thought it was a great opportunity. Most of the people we were interested in attended the meetings, and they could hit multiple faculty members, and it could save them cost and travel and all that kind of stuff. It wasn't perfect because it is nice for applicants to see the facility. But we thought it was a great compromise, and we may go back to that. Since COVID, everything has been virtual. Our last cycle was virtual, and that certainly has its benefits too, particularly cost. Again, I think there are things lost by doing things virtually, particularly, what is my environment going to look like? What are my facilities? Where am I going to sit? All these types of things where you kind of feel comfortable when you interview. Those things are lost, but obviously we went to that format for a reason, and it has great value for many people. I do think we are going to go back to the live interviews in the ASDP, but we haven't decided whether we're going to do it this year yet. But I think it's going to be program dependent.
So before I start, I'm just going to answer a question that was in the chat. I'm at the Cleveland Clinic. We also do virtual since COVID. I think we will continue to do virtual this year. It's expensive to have to travel around and do all that and take away from your training program where you are currently to be able to attend all these interviews. And so we're very sensitive to that and try to do virtual. I think virtual can be very good. We can learn a lot about you, and you can learn a lot about us. I would really encourage you, if you do virtual interviews, to ask to speak to the current fellows, because they are a wealth of information. They're the ones that can tell you what your day is like. You'll get the sense if they're stressed. I mean, they may not tell you that outright, but you can kind of get the sense if they're stressed about the program by you ask them, what's your day like? What time do you have to be there? How are the attendings nice? Like, those are really important things to find out about the program, and the current fellow is really a good source for that. So ask to speak to them, ask to be connected. You could do a Zoom with them if you're virtual, and they can tell you, are the facilities nice? Do you get to talk to the dermatologist, or are you isolated away from them? Or, do you get to see pathology, or are you only in dermatology? So I think that can be really helpful.
And I think this overall points to the fact that the landscape is probably going to be a bit split. I can give the perspective more from being a dermatology residency director, which kind of falls under, all of the fellowships and residencies, is that a lot of this has been up to more institutional guidelines. For those of us at larger institutions, it's really been what the individual GMEs have said in terms of interviews for the past couple of years. And then also what the national societies have said in regards to this. Different groups have come out with different recommendations. I believe that we're probably not going to be having as many stringent recommendations. So it's going to be different. And it goes to the fact that you may need different interview skills depending on whether it's going to be an in-person interview or a virtual interview. So again, with that, I'm going to transition it over to Rachel, who can talk a little bit more about what to think about for interviews.
Yeah, so hello everyone. This is great. I hope everyone's having a good time. I'm learning a lot. So basically, I do think that at this point we'll sort of go with the virtual, because I think that's probably what most people are going to be doing. And so that does kind of change up, what is the day like? Because it's not a day anymore. It's basically, a bunch of interview sessions online. And so, I guess from the people who give the actual interviews, and that's including myself, if you could give one piece of advice, the most important thing that you could think of, I think that would be helpful for applicants to hear? If you could just each give, one piece of advice to everyone, what would you give? And Greg, do you want to just start, if you don't mind?
Yeah, do you mean advice to the applicants about, during the interview?
Yeah, during the virtual interview now, because it's basically a conversation essentially. And I mean, you can give more than one piece of advice, but I think some of the things that have struck you over the past 3 years in terms of, what really comes across to you, what are some either questions that that you like to ask, or if you just have like one piece of advice or two pieces of advice about how people can sort of handle themselves and make the best virtual session now that basically a day is condensed into 30 minutes.
Yeah, so I would say it's human nature that people, interviewers, they do like to talk, and they like to talk about themselves in a lot of ways, even though they're really interviewing you. But I think with that in mind, I think it's really important to come to the interview informed, know something about the program, know something about the people who are interviewing you, and maybe ask them pointed questions, not something that they can read on your website, but maybe something personal, like, why did you choose, your program versus other programs, or something personal where they can, again, reflect back and talk about, and maybe give you some advice that you just can't pick up on a website. And I think those spark really interesting conversations.
Great. That definitely would make an impact. Melissa, do you have any thoughts?
Yeah, I think Zoom interviews can be really hard. I think it's important to just really try to be yourself. And, when we are talking to candidates, everybody who we're interviewing is qualified, and we could train any of them to be a phenomenal dermatopathologist. We're really looking for people who will fit in with our group, who will have a good time with us. We want people to come and be happy with us. So we're looking for people who will fit in with our group, who we have 3 or 4 fellows a year. We want people who can get along with a team, but we really want to see who you are, and you should want to see who we are, so that you'll, if you'll fit in or not, and what we have is looking for you. It is what you're looking for. And I think it's completely normal to be nervous. I mean, everybody's nervous in an interview situation. I don't care what you're interviewing for, a CEO position, you're still the interviewee is still nervous. And we expect that, and we understand that, but still try to relax enough so that you can show who you are, and have a good, productive conversation. And know that whoever's interviewing is not scary. They're not going to be mean to you. They just really want to get to know you.
Great. Yeah, absolutely. Catherine and Alex and Brandon, I know you all are, and Matt, you're probably all involved in the interview process. Anything you want to add?
I would just echo exactly what Greg and Melissa said. So one thing that always kind of will take me aback is if I'm interviewing someone and they clearly have no idea who I am. And it's really awkward. It's not, I don't necessarily take it personally or offensively, but it makes it really awkward. So do know who you're going to interview with and something about them. And be yourself. Don't say something that you don't mean. So don't say you really want to do a lot of research and do academics in lymphoma, when that's really not your thing, or alopecia, because you think that's what somebody wants to hear. Just be honest. And I think I echo what Melissa said, is like, we're looking for someone who will enjoy their time during their fellowship year, and that, and will fit in well and come away with a really great experience.
Yeah, because you end up spending a lot of time with these people day in and day out, and you want it to be a good fit, right? For everybody's quality of life. I think that is huge, right? So you may as well just be yourself, because otherwise it's going to be a year of hell. So anyway, Alex, what about you?
I think everyone's spot on here. Every program has a different feel. Not every program is going to be exactly the same. So you'll find that fit that works for you. So ask the right questions. Don't be afraid to ask questions. Because like we said, I think when we're interviewing, a lot of times we're focused on not only learning about you, but also telling you about the program. So there might be something that we're missing. So you really, we want to hear the questions, and those questions can actually help guide us about what kind of fit you might be for the program as well.
Great. Brandon or Matt?
Yeah, just more of the same. I think the biggest part is just to relax and be yourself. When I interview people, I feel like for the most part, I'm just trying to sell the program. Like I'm in 30 minutes, I'm trying to tell you as much as I can about our program. And I want you to like us just as much as you want us to like you. So yeah, I think that's the biggest thing. Just relax, be yourself. And some of the best interviews I've had, I feel like are just conversations. Like there's a little bit of joking or telling stories, just kind of getting to know each other. So yeah, be yourself.
Matt, do you have anything?
I agree with what's been said. The biggest thing for me is fit, and just having a nice, normal conversation can go a long way. We've already reviewed your CVs. You were invited to interview because you're a good applicant. But we spend a year very closely with you, and I want to make sure that that year is going to be enjoyable for both of us, and for the rest of the DermPath team. So that's really what I'm looking for on interview day.
Jennifer and Dari, I know you guys haven't been involved in any interviewing right yet, or if you have, please offer. Sometimes people at different levels interview, so I don't want to leave you out, but I also wouldn't expect you to be involved in the process at this point. Okay, I have a question about this. This came up last year, and it was really something that struck me. How do people feel about what you choose to show in the background of your interviewing space? Because some people, I think, like to have things on the wall, and then that sparks conversation, and I think for other people it's distracting. So I was just wondering what you guys thought about that. I'm not exactly sure how I feel. I guess it just depends on what's hanging on the wall, or if they have like a bicycle in the background. I mean, it's stuff like that. Like sometimes I really like it, but then if it's too much, then I get distracted. So I don't know. What do you guys think? But that definitely struck me from last year, that I really thought about, just thinking about how you present yourself. So
Yeah, I would say, it's an extension a little bit of how you would show up to an interview dressed. I mean, you're not gonna wear a cape, right? I mean, you're gonna wear something, something professional. And I would say keep the background professional. I mean, it can be interesting and professional, but just keep it professional.
You don't want a big picture of a pot leaf on a poster behind you. It's fine. Just put it on the other side of the room, because, some of that, it shows judgment, and maybe people don't really care about what you have. They probably don't. I don't really pay that much of attention to it, but it goes into the whole thing about judgment. And when we're looking for fellows, we really want somebody who has good judgment about what's appropriate and what's not appropriate, what we can do, what we can't do. So have a plain background. No one's going to be upset if you have a plain background. You can get a DermPath slide if you're not sure. I think a plain wall is fine. I think, some people want to do like a little book and a little flower, like that's fine too, because that shows maybe you're a little more creative than I would be with a plain background. But I think keep it professional is the biggest thing.
anyone else?
I remember this conversation that we had. Now that you brought it up, this was a whole debate. One thing I'll say, because I think about this a lot too. You can't go wrong with a blank background. Like no one is going to fault you. No one is going to think you're boring or anything like that. However, if you think that you want to draw attention to something, or you want to draw something into the conversation, like you said, if you're a biker, you want to talk about some activities you had to work, you can have that strategically there, but just, be ready to answer questions about anything that may be in the background. Because I know that when I have dead time, when people have run out of things to say and we're trying to figure out whatever's in the background will come up as a question. So be ready for it.
Catherine, what about you?
Yeah, I agree with Alex. It's tricky, and I don't judge necessarily, but some things are hard to ignore. So I just remember one interview I did, and someone strategically, I think, meant for it to be part of the ambiance, put a very, very large house plant, and it kind of partially blocked her. And I cannot remember for the life of me anything about the interview except this huge plant. And so you want to think about things like that, because that's certainly not, ideal. Is that it's like, oh, how was that interview? And I am thinking about the applicants like, she had a really big plant, so.
And you probably don't want your bed that's piled with clothes on it in the background. And I've seen that on derm interviews, like and a dog sleeping on the bed, like all behind them. Like, you probably don't, just turn your camera so it's a plain wall behind you. Again, it's just judgment.
Yeah.
And Brandon and Matt, do you have anything you want to add?
Maybe we need to transition to like a standardized background of spongiosis with parakeratosis. Maybe that's what we're working. Oh, right there. Okay. No, I think, yeah, I think it could be a good conversation starter. I think it is an extension of yourself. Yeah, I agree with everyone here.
Matt?
I would just say I probably would struggle in a Zoom interview right now. I do not have the standard background. I have a lot of computer issues, but for me, I think it would be it's a matter of professionalism. If you went to an interview in person, you'd be wearing a suit, you'd have a firm handshake, like all the things that you're used to, just being a professional, having things flying around you in the background. That's what we get to see on Zoom. We won't get to see if you're wearing your running shorts and flip-flops. We won't see that. We would see that if it was in person, but we do see the background and kind of the way you present yourself. So I think it's just a matter of professionalism.
Okay, so we're kind of moving through. Alex, do you want to move on to the next set?
Sure.
Or I want to make sure we leave enough time.
Yeah, so here's what I think we'll do, because we want to look at perspectives, and I know we have a bunch of Q&A. So I want to put one question out there I think is really important, and that's going to be one for Jen and Dari. So you guys are just about the end of your fellowship. You've gone through the application cycle, you've done your fellowship. Is there anything that you would change on your approach to either fellowship or the application cycle after having gone through the process at this point?
For me, I want to I don't know if I would say change, but I can definitely think about things that I think maybe if I'd done earlier. One for me is maybe as soon as I came in, I should have maybe asked the derm residents sort of the materials that help them get up to speed, because I know I had just 1 year for that. Because I found out somewhere along the line that they had all these great materials that if I had initially like asked them, and it would have probably accelerated my learning at the initial part. So I thought that was something that I can say if anyone listening gets into fellowship, whether it's derm or part, the residents on the other side just kind of like try to get what they are using, because you might just be going with the standard text or whatever you think would work, and they might have a better idea. I think also another thing is, I think it's advantageous to, it's not always the case, but to know what you're going into, what you're looking for in that program, and start pursuing it as you come in. Sometimes your interest might change, and so I guess that might not apply. Yeah, those are kind of the two things that coming off the top of my head.
All right, Jen, what do you think?
Well, I don't think there's too much I would change. I think in general, it is really difficult to apply 2 years in advance. I think that's just hard. I learned so much more in the last 2 years of my dermatology residency and kind of changed the career that I thought I was going to have to like what I am currently at. I mean, it just changes in your last 2 years of residency, and there's nothing you can really do about that. But you can't really change that. I am happy like I went straight through. I guess similarly, it would have been nice to spend maybe when I like at the first half of the year spent more time with the pathology residents. At least the way our program is, sometimes it can kind of be hard to spend a lot of time with them. But as I got to know them more, I learned a lot from them, and that was really helpful. Yeah. I mean, I guess I don't know. There's just so much to learn, a lot of things to do. But I don't know. There's not a lot that I would change, honestly.
All right, thanks. All right, now some Q&As that are coming in. So one, we've seen 2 questions though, so I'll start with that. Step 3, do you need it? How does it play into the application? And I'll leave this open to everyone.
I'll say, I think, we look at the board scores, but once you've completed a residency program, I think those step 1, 2, and 3 scores are less important. Step 3 is so clinically oriented. I think it's less important for DermPath. You don't want to fail it, but I think if you passed it and it's in the application, I think we're really looking at least in our program, we're really looking at an applicant more holistically, rather than at specific test scores like we might look for a derm residency candidate.
Everyone else feel similarly? Anyone else have any differing perspectives?
I think people are all over the board on this one. I know some people who really pay attention to them because that's kind of what they've done in the past, and that's provided good results for them. And I know others who are not as interested in them, like they've gotten to this point, and so now it's just about the person, getting to know the person, and are they going to be a good fit. So I think it really depends on the person, and I don't know how you'd know that unless you ask them. That's not something you're going to ask them, but I think it's all over the board. That's been my experience. So.
At this point, your step 3 score is what your step 3 score is. You're not going to take it again. If you haven't taken it, do the best you can, and it can only help you. But, I think you can't stress about it is what it is.
So another question that's come in, are programs required to post if they have filled their positions internally, or do we need to reach out to them to ask?
They're not required. I mean, we don't have any enforcement with this whole process. So we ask coordinators to go to the ASTP and update their page, whether or not they filled, et cetera, et cetera. But it's kind of up to them to do it. So I think in the end, it's going to require contacting the programs.
Yeah, that's true. It kind of goes to the fragmented nature we have with the process as it stands. Melissa, you're going to say something.
Yeah, I was, yeah, and I think that's true. I think it's fragmented, and I completely agree with Greg said. I was just going to add that, I have had people who didn't find a spot kind of at the October, a year and a half ahead or whatever timeframe. I tell people don't give up, because spots open. People's lives change. They change their career path. Something happens and spots open up, within 6 months of the start date. So if you're somebody who's waiting and you didn't get it, really keep your ear to the ground, have your mentors kind of listening also, because spots will come. We've had spots open up a month before they started, and, somebody's dropped into a really nice position that way.
Great. And then another interview, or I guess application related question, is there an advantage to having more than 3 letters of recommendation sent?
I mean, more is not always better. I mean, I kind of go back to, is this person able to read directions? If there's directions associated with the application, more is not better. but in the end, with letters of recommendation, for, anyone can write a good letter of recommendation. I think it's super, super helpful when it's somebody I know that wrote it, because I kind of know how they write letters and and I can read between the lines of those letters. But so with that in mind, as an applicant, I think it's important to get letters from people in the DermPath world, because a lot of us aren't going to know your your neuropath faculty member, or maybe your MF faculty member on the derm side, if they're not in the DermPath world. Not to say that you shouldn't get those letters if they're strong, but I think you should have at least somebody in the DermPath world, and you should ask them if they're willing to write you a good letter. And hopefully people will be honest with you and say, I don't feel comfortable with that. And then you find somebody else. But I found letters of recommendation to be game changers, potentially, in the application.
I think that's great. Like you said, it's not number, it's quality associated with the letters. All right, now I'm going to combine several questions over here, because there's a lot of questions about advice or what you're looking for in an applicant. So what would you say to non-traditional applicants, or applicants that may not have as much research? So for instance, early derm residents may not have as much research as a path resident who's had an extra year. What advice would you give to applicants in some of these specific situations?
So I think people understand that you're a derm resident and that you have been learning, just trying to learn derm, drink from a fire hose to learn derm that first year in, and you were an intern and probably an internal medicine kind of role. So super busy. And then you're drinking from a fire hose trying to learn derm. So I think people understand that. Fortunately, many dermatology residents have done a lot of research to get to dermatology. So that shows that you can do it, that you have an interest. And then when you go to your interview, have something that you are thinking about, a project that you're starting or that you're kind of in the early phases, so that you can tell them, here's what I'm going to do. So they know that you have some research mindset. And we've trained the non-traditional candidates, I think, are really good questions. We've trained several pathologists who have been out in practice for several years. We've trained some dermatologists in a similar position, or dermatologists who've worked for a year and then joined us. They do great. I think if you are in that position, so you're I have a fellow right now who's like maybe 8 or 9 years out of residency training. And, I think you have to have a good story as to why you want to do it and why the program should take you, what is driving you, so that the program really has a good sense of what your goal is, what you want, because you have a much different goal than somebody who's just coming, who's still in training and applying. And I think you have to show that you're humble enough that you can go from being an attending and tone it down so that you can learn and be in more of a role. If somebody tells you, this is the answer, or I need you to do this, that you can flip that switch from being the person who's telling the staff to do things to then being able to listen to what your new DermPath staff is telling you and teaching you, so that you can learn. And that's really, I think that's the most important thing. And the thing that in my group that people worry about, will that person be able to go from being an attending to be able to function as a fellow in a way that they can still learn and it's not confrontational?
I would add to that in the sense, and I think this can be said for people applying to, if you have friends or family applying to college, if they're applying to medical school, if they're applying to residency, that there's definitely been a shift in the application process. And I feel like, to Melissa's point, it's become even more important these days to have a story. And what I mean, not everyone has this great story, but it's your story, and you can make your story great. And what we want to know is, why do you want to do this? Like, why are you here? If you're a non-traditional applicant, what was that trigger that took you from career A to career B? And in a lot of ways, the non-traditional applicants are super, super interesting because they have a story and there's a reason they're doing what they're doing. And that catches our attention. So you don't have to be the person who has been at the last 5 ASDP meetings and published in DermPath, but we want to know why you want to do this, and you need to be convincing, because because you got tired of your job as a hospital pathologist and you heard you could make more money, I mean, that's not a great reason. So I think you need to be true to yourself and why you want to do this, and you need to be able to articulate that well during the interview process.
And I think don't sell yourself short if you're a non-traditional candidate. You have skills and experience that somebody in residency does not. You have more maturity, you have more experience, you may be able to navigate problems better, you may have better leadership skills. So show your strengths that you bring to the program, and that I think will serve you well.
And it sounds like everyone on this panel is doing a lot of holistic review. So really looking at the full application and all the angles. And so I know a lot of the questions coming in have really been discussing, what if I don't have this, or what if I don't have that? So, I think the big takeaway, at least the one that I get, when I'm listening to everyone is, don't think that just because you don't have X number of publications or X, Y, and Z type of letters that you automatically would not be a strong applicant. You have to put it in, get letters from people who know you well, even, if they may not be the most traditional letters. Try to have DermPath related things that are supplementing it, and, put your best foot forward. Use your personal statement to show these too. I think there was a question about that. But with that, it's 9 o'clock. I know that we answered a lot of questions. We may not have gotten to everyone's, but I hope that we gave everyone at least, an overall sense of the fellowship process. So with that, I really want to thank our panelists, our participants, and hope everyone has a great night. Thanks again.